Welcome to this video on closed wounds and drains, essential concepts in surgical care and post-operative management. Let's break it down clearly, covering definitions, types, functions, and clinical importance. What is a closed wound? A closed wound is an injury where the skin remains intact. There is no breaks in the surfaces, but damage occurs underneath the skin, often involving blood vessels, tissues, or internal organs. The most common examples of closed wounds include contusions or bruises, where blood vessels are crushed, causing discoloration, hematomas, where blood pools under the skin, and sprains due to torn ligaments from joint injuries. These wounds are deceptive. Even without an open cut, internal bleeding, swelling, and tissue damage may be significant. What are drains and why are they used? After surgery or in certain wounds, drains may be inserted into the wound site. So what exactly is a drain? A drain is a medical device placed in a wound or surgical site to either remove unwanted fluids like blood, pus, or other secretions, prevent accumulation which can delay healing or cause infection, help reduce pressure and swelling, allow doctors to monitor bleeding or infection post-operatively. In short, drains are crucial in promoting healing and preventing complications. Classifications of drains. Drains come in many types. Let's look at how they are classified according to their mechanism of action. Passive drains and active drains. Passive drains rely on gravity and capillary action. Example, Penrose drain. Active drains, however, use suction or negative pressure to pull fluid out. Example, Jackson, Pratt, or Hemovac. Perhaps according to their system, whether it's open or closed. Open drains expose the wound to the environment, which causes higher risk of infection, like the Penrose drain, for example. Closed drains, however, are connected to a sealed system, reducing infection risk. These are preferred in post-operative surgical drains. Let's explore the fundamentals of tubes, drains in surgical care based on the hand. First, we start with the basic measurements. The size of the cannulas is typically described using the gauge system, or G. The gauge number inversely indicates size. A higher gauge means a smaller diameter. For tubes, however, we use Jacques-Charard scale, or F, where 1 French equals 1/3 of a millimeter. For example, a 9F tube would be 3 millimeters in outer diameter. When referring to wires, a standard size is often 0.035 inches in diameter. Let's address the clinical reasoning behind drain usage. Why do we insert a drain? Drains are essential to remove accumulated fluid, such as blood or pus, as discussed earlier. How are drains fixed? They are often secured using sutures or adhesive devices to prevent displacement. We must also ask, which type of drain is appropriate? The choice depends on the surgical site and purpose, whether it's for passive drainage or active suction. Care during removal is critical to prevent infection or tissue damage. When to remove a drain typically depends on output volume and characteristics, indicating whether healing is progressing or not. Let's compare closed versus open drainage systems. Closed systems are sealed, reducing infection risks. They don't require frequent dressing changes because there is no external soiling. They also allow for more accurate fluid measurements. However, they can be prone to obstruction. Open systems, on the other hand, are more susceptible to contamination, but may be used in specific cases where free drainage is needed. Examples of open drains include corrugated rubber drains, Penrose drains, sump drains, and those connected to suction. These principles help guide proper post-operative care and prevent complications, ensuring faster and safer recovery for patients. Drains are also separated or classified according to the material: rubber, plastic, or silicone-based. Each type is chosen based on the patient conditions, types of surgery, and expected fluid drainage. Types of drains and their uses. Now let's go over a few common types of surgical drains. Penrose drains, a soft rubber tube It's passive and open drainage system used in superficial surgeries, allows fluid to exit through capillary action. Jackson-Pratt or JP drain, a bulb-shaped suction drain, closed and active, common in abdominal orthopedic surgeries, allow easy fluid measurements. Hemovac drain, similar to JP but used for larger volumes. It's flat, spring-loaded, typically used in joint replacement surgeries. Redon drain, another active closed suction system often used in thoracic and abdominal procedures. Care of patients without drains, with drains. Proper care of drains is key to preventing infection and ensuring healing. Here's what healthcare providers monitor: amount and type of drainage, whether it's blood, pus, serous fluid, color and smell. Changes can indicate any infection. Patency. Is the drain blocked? It should flow freely. Site of insertion. Watch out for any signs of infection like redness, warmth, or discharge in the site of insertion. Securement. You have to make sure that the drain is fixed and not tugging. The drain must also be emptied and measured regularly. Nurses document the output and report abnormalities. Drain removal is done once drain is minimal, usually under sterile conditions. Complications to watch out for. Drains are helpful, but they can cause problems if not managed correctly. The primary problem is infection, especially with open systems. It can cause tissue irritation or necrosis. It can also cause blockage or displacement, premature removal, pain and discomfort. That's why meticulous care and observation are so important. To summarize, closed wounds may not bleed outwardly, but they can be serious. Drains play a huge role in healing by removing unwanted fluids. Different drains serve different purposes, and proper care is vital to avoid complications. Thanks for learning with us today. There is a small algorithm that we need to discuss. Let's walk through this clinical algorithm for managing a patient with a drain. Step 1. Assess ongoing fluid output. First, determine whether fluid is still draining. If there is ongoing fluid, the drain may no longer be necessary and removal should be considered. If there is ongoing fluid, proceed to step 2, which is evaluate clinical parameters. Here, assess 3 key factors: the patient's clinical condition, the amount of fluid, and the characteristics of the fluid. The clinical condition of the patient is: are they stable, febrile, or showing any signs of infection? The amount of fluid includes the volume. Is it increasing, decreasing, or stable? The fluid itself, the characteristics of it, such as the color or consistency. Is it clear? Is it bloody? Is it purulent? We move on to step 3. We determine the trajectory. Based on these parameters, decide whether the patient is improving or worsening. If improving, continue monitoring the drain. If output declines steadily and the patient remains stable, plan for eventual drain removal or discharge. If worsening, we take action. Increased pain, fever, or abnormal fluids may indicate complications. Check for any drainage obstruction. This might require flushing the drain or imaging to confirm the blockage. If the drain is no longer functioning or the issue resolves, cease drainage and consider alternative treatments. Final notes: this algorithm emphasizes balancing observation with intervention. Always correlate findings with the patient's overall status and use clinical judgment to adapt steps as needed. Thank you.